Pneumonia, an infection of the lungs, poses a serious threat to older adults. As we age, our immune systems naturally weaken, making us more susceptible to infections like pneumonia. This vulnerability is compounded by existing health conditions that are more common in seniors, such as heart disease, diabetes, or lung disease. These underlying conditions can make it harder for the body to fight off infection, leading to more severe cases of pneumonia and a higher risk of complications. It's crucial for seniors and their loved ones to be aware of the signs and symptoms of pneumonia so they can seek timely medical attention. Early detection and treatment are key to fighting pneumonia effectively. Recognizing the subtle signs of pneumonia in older adults can be particularly challenging because their symptoms may differ from those of younger individuals.
Pneumonia often announces itself with telltale respiratory symptoms, such as a persistent cough that produces phlegm, shortness of breath, and chest pain that worsens with breathing. However, older adults may not always present with these classic signs. Instead, they might experience more subtle symptoms, making early recognition crucial. Confusion, a sudden change in mental status, or increased fatigue can be red flags in seniors, signaling a possible infection like pneumonia.
Furthermore, systemic symptoms like fever, chills, muscle aches, and loss of appetite are also common in older adults with pneumonia. Physical examination by a healthcare professional may reveal rapid breathing, a rapid heart rate, and wheezing or crackling sounds in the lungs. It's important to remember that fever, a hallmark of infection, may be absent or blunted in seniors. Therefore, any significant deviation from an older adult's baseline health, especially when combined with respiratory symptoms, should not be ignored.
Treating pneumonia in older adults involves antibiotic therapy, supportive care, and close monitoring. Antibiotics target the bacteria causing the infection. Prompt initiation is crucial to prevent further lung damage.
Supportive care includes oxygen therapy and hydration. Oxygen therapy improves blood oxygen levels. Medications reduce fever and relieve chest discomfort. Hospitalization may be required for severe cases.
Pneumonia can lead to serious complications, particularly in older adults. One potential complication is respiratory failure, where the lungs struggle to provide enough oxygen to the body. This can be life-threatening and may require mechanical ventilation to assist breathing.
Another serious complication is sepsis, a life-threatening condition that occurs when the body's response to infection spirals out of control, leading to organ damage.
Pneumonia can also increase the risk of lung abscesses, which are pus-filled cavities that form within the lungs. These abscesses may require drainage and prolonged antibiotic treatment.
Other complications include heart problems, such as irregular heartbeat or heart failure, as the body strains to compensate for the infection. Prompt recognition and treatment of pneumonia are essential to minimize the risk of these complications.
Diagnosing pneumonia involves a combination of clinical evaluation, laboratory tests, and imaging studies. A healthcare professional will begin by taking a thorough medical history, asking about symptoms, recent illnesses, and any underlying health conditions. A physical exam, including listening to the lungs with a stethoscope, will also be performed.
Laboratory tests play a crucial role in confirming the diagnosis and identifying the culprit behind the infection. A complete blood count, or CBC, can detect signs of infection such as an elevated white blood cell count. Blood cultures may also be drawn to identify the specific bacteria causing the pneumonia, guiding antibiotic treatment.
A chest X-ray is a key imaging test that can reveal characteristic patterns of inflammation or fluid in the lungs, confirming the diagnosis of pneumonia. In some cases, a sputum culture, where a sample of coughed-up phlegm is analyzed, may be helpful in identifying the causative organism.
Tuberculosis, or TB, is a serious bacterial infection that primarily affects the lungs. TB can cause symptoms similar to pneumonia and should be ruled out, especially in older adults.
TB screening is crucial for those with risk factors like close contact with TB, travel to TB-prone areas, or weakened immunity.
The tuberculin skin test, or MAN2 test, is the most common TB screening method. It involves injecting a small amount of tuberculin under the skin of the forearm. The site is checked 48 to 72 hours later for a reaction.
A positive test indicates TB exposure but not necessarily active TB.